So let's see it in a comparative manner now. So all these IDA, sideroblastic anemia, anemia of chronic disease, and thalassemia, even lead poisoning. Lead poisoning was a cause of this sideroblastic anemia, right? So all of these were causes of microcytic hypochromic anemia. So thalassemia, we'll be reading about it in hemolytic anemia. So if you see the serum iron is going to be diminished in both IDA and anemia of chronic disease. While in sideroblastic anemia, iron, ferritin, and the serum transferrin saturation is going to be elevated. So the only condition in which TIBC is going to be elevated is going to be the iron deficiency anemia. And then as such, if you see the serum transferrin to log of serum ferritin, which is the most sensitive test for IDA, there is going to be more than 1.5 in IDA and less than 1.5 in ACD, which is anemia of chronic disease. So all the serum iron studies is going to be normal in thalassemia, while the Menzer index is going to be more than 13. So Menzer index is MCV upon RBC. More than 13 in IDA, while it is less than 13 in thalassemia, right?